So we learned this week the arthritis medicine Celebrex might prevent lung cancer from developing in ex-smokers. If so, it would represent a huge step forward in the fight against cancer. That's the subject of our weekly look at how to get healthy and stay healthy. Healthy living expert Dr. Bill Lloyd joins us now from Sacramento. So Dr. Bill, about 100 ex-smokers were involved in this clinical trial. Why do researchers think that Celebrex may have prevented some of these patients from actually getting lung cancer?
Scientists have known for a long time that the chemical signals that control inflammation in the body also play a role in the transition from healthy cells to cancer cells. So they said, wait a minute, what happened if we used a powerful anti-inflammatory drug? Would that have an effect on those signals and prevent healthy cells from becoming cancerous?
Wow, so will there be more testing before the drug actually goes up for FDA approval?
Sure. Now, this recent study was a pilot study, like you said, 100 or so. That's a phase 2 trial. So what they're going to do now is recruit thousands of people. Again, these will be heavy smokers, 30 years or more of smoking, who have quit for at least a year. All right? They've quit for at least a year, and then they'll be given the Celebrex, and then they'll do a special biomarker test to see if their cells have not made the change to cancer. So far, cells that of patients that take the Celebrex do not go on to form the lung cancer. So it's a very promising opportunity to protect people from developing lung cancer.
So the oncology world is pretty excited about this trial for obvious reasons, right?
You know, the prognosis for lung cancer, any lung cancer, is dismal. They're making headway. There is some improved survivorship. We've talked about that in the past. But overall, it's still a very grim diagnosis. So anything that can protect somebody from actually getting lung cancer is a real positive.
So would all ex-smokers be candidates for this, or just people who smoked for most of their lives and just recently quit, or what's the combination?
I think the people who have smoked for a long time obviously are at a much higher risk of getting cancer, and these are the ones that they're targeting for this study. But it's important to know that drugs like Celebrex are very powerful agents, and they have side effects. People who take Celebrex can get into heart trouble, kidney trouble, and liver trouble. So they have to screen these patients, not just for their smoking history, but are they healthy otherwise, so that they could tolerate this therapy if it became approved by the FDA.
All right, and then what would a patient do or an ex-smoker do if they want to explore the possibility of taking Celebrex?
Well, conventional therapy first. You get with your doctor, you're worried about lung cancer. Make sure first that you've had a good screening chest x-ray and no other findings to suggest that you already have lung cancer. But if you're one of these candidates that might be able to tolerate Celebrex, you and your doctor can discuss the risks and benefits. It's important that nobody start a medicine, stop a medicine, or change a specific dosage of a medicine without first talking to their doctor. And then the two of you can have a discussion as to whether or not you'd want to enter one of these trials and take Celebrex with the hopes of protecting yourself from getting lung cancer.
All right, fascinating stuff. Thanks so much for helping us live healthy, Dr. Bill Lloyd.
We'll talk again soon.
All right.